Zeke Crane had one goal: to ride his Harley. He's back on his bike for the first time since last year when knee pain became too much to bear.
At work, if I made a sharp turn, just like my knee started hurting. The next one time in the library, I just thought I was going to hit the floor.
Zeke plays hard and works hard as a custodian at Southern Boone High School. At University of Missouri Healthcare, Dr. A.J. Agarwal identified the problem: osteoarthritis. Wear and tear had worn away the cartilage in both of Zeke's knees. Based on his x-rays and other factors, Dr. Agarwal recommended knee replacement surgery.
It's like a combination of how bad is the pain, how bad it is affecting the functional life, and what activities patient has to cut.
Roughly 300 times a year, Dr. Agarwal performs a knee replacement, removing the diseased joint surfaces and replacing them with metal and plastic implants. After surgery, Zeke began rehabbing at Mizzou Therapy Services Ashland Clinic. It's located in the new Southern Boone area YMCA, and thanks to a unique partnership, patients can use the gym to build up their strength and mobility.
In Zeke's case, we have him pushing a leg sled and pretending that that's his custodial cart. So if he can do that here, back and forth, we know he's ready to go back to work.
Now, 2 months post-surgery, Zeke says his knee pain is nearly gone, and it's easier to get on his motorcycle. His balance is improving too.
Because I've talked to a lot of people who's had knee surgery. They said best thing I ever did, and I'm kind of agreeing with them.
Getting revved up for a summer back on his hog. From the University of Missouri, I'm Teresa Snow.